Hello colleagues, my name is Daniel Walton and today I'll be presenting to you a video resource about managing behaviours in the classroom. The information that I'll present to you today is based on interesting points I found through modules 3 and 4, which specifically are focusing on Dr. William Glasser's control/reality theory and Andrew Fuller's work on teen development. Behaviour management comes under two AITSL standards, the first standard being 4.3 and the second standard being 4.4. As a teacher, it is important to maintain student safety, which is done by managing the challenging behaviours some students have. Behaviour management in the practical sense is prescribed to be one of the most important components of teaching. Without it, it's even laughable to call you a glorified babysitter. To be successful at behaviour management within the classroom, there is two important components we need to know. We need to know the instigators of poor behaviours and strategies to prevent those poor behaviours. In going through the resource today, I'm going to specifically talk about some of the points that Dr. Glasser and Dr. Fuller exclaim through their findings, and then the strategies will specifically look at choice/reality therapy, along with a couple others found throughout the research done in the modules. In accordance to William Glasser's choice/reality theories, humans have 5 basic needs they seek for the purpose of feeling fulfilled and happy. Whether these needs are met adequately determines the status of any human's well-being, which influences academic achievement, enhanced mental health, and responsible life choices. The 5 needs William dictates are survival, love and belonging, freedom, fun, and power. When these needs are not met within the classroom, behaviour issues will occur in order to try and attain them. This is attributed to how the adolescent brain functions. Research depicts that cognitive processing in teens primarily occurs within the limbic system, therefore defining that the outburst from teenagers is attributed by their desire to fulfill their basic needs. Andrew links the contributors of bad behaviours within our students down to 2 aspects, the first being routines and habits, the second being neurochemicals and hormones. In being specific as to how those aspects link, we need to explore how the teenage brain works. The behaviours which occur in adolescence is the product of the interaction between the prefrontal cortex and the limbic system. Both components within the brain are the primary places in which cognitive processing occurs. Executive functions such as planning, forethought, and impulse control come from the prefrontal cortex. In comparison, the limbic system regulates emotional responses and motivation. Whilst teenagers undergo the bodily changes associated with puberty, the brain also undergoes significant remodeling within the prefrontal cortex. Evidence in the form of brain scans reveals a significant amount of grey matter within the frontal regions is prevalent between the ages of 13 and 21 years old, hence indicating that this remodeling is prevalent. In consequence, the limbic system dominates the majority of the thinking occurring within our teenage students. It is due to the limbic system's dominating influence over adolescents' thought process that behavior outbursts occur. Within the limbic system, decision-making is driven by 2 main factors, which has been described by Andrew Fuller. In the state in which a teen is experiencing negative emotions, the brain is flooded with hormones such as adrenaline and cortisol. This in turn prevents any form of reconsideration or reflection on behaviour, hence preventing the primary function of the prefrontal cortex. In being more specific, teenagers who have high levels of adrenaline present are often hyperactive, demanding, defiant, and rebellious. Essentially, adrenaline initiates a fight or flight response in order to deal with an environmental stimulus which initiated the response. When being in this state, students' thinking becomes more rigid and less flexible, hence changing their mood and trying to prevent behaviors becomes impossible. Cortisol is released in conjunction with adrenaline and is responsible for anxiousness within adolescence. Teens with high levels of this hormone exhibit behaviors of pessimism, worrying, difficulties in prioritizing, and issues in expressing thoughts. To delve further, the production of cortisol triggers interruptions within the hippocampus, the frontal lobes, and temporal lobes. This results in students becoming unable to communicate their feelings and retain information. Dr. William Glasser's choice/reality therapy implements behavior management by utilizing the fundamental needs of all humans to motivate any said person to achieve. Previously stated, choice/reality theory dictates humans have 5 basic needs that they strive to attain. Outbursts in the form of inappropriate behavior come from the said child trying to fulfill one of these needs. Whilst this can be detrimental in creating the ideal working environment, we as educators can harness such impulses to get students to work efficiently. Before such a technique was utilized in the education setting, traditional psychologists would implement reality therapy as a part of their own practice. The technique that is applied in the classroom is a modified version of what psychologists practice to better fit within the classroom setting. Choice/reality therapy requires 5 steps in order to practice it. The first step is to observe the disruptive behavior that occurs. This does not mean to simply watch the child perform the behavior, but to align it with the reason why it is occurring. Once an understanding of the motive is gained, you want to explain to the child that their behavior will not attain the consequence they want. After doing so, suggest alternative behaviors which will gain the need they desire, and finally have the student implement this behavior and follow through with corrections and encouragement for practicing the desired behavior. In performing the steps defined by choice/reality therapy, the ideal learning environment is achieved. There are 2 components that make this method effective. The first premise is that student chooses their consequences, followed by the relationship a teacher has with their students. In having students recognize the consequences of their actions, they feel as they are in control of their own world, meaning they will behave to achieve what they want, in turn modeling appropriate behavior for the classroom. When executing corrections as a part of the strategy, it is important that you have rapport with the students. Brains are wired to resist correction as it causes a power struggle between both the person being corrected and the corrector. Having a relationship with the students helps to remove defiance, as the need of belongingness can be jeopardized. Other behavior management strategies that are similar to choice/reality therapy include responsibility theory. This ties in with students' need for power. Through implementing rules the students design, you can achieve classroom management, basically similar to choice/reality theory. Before, with talking about building rapport with students, connect before you direct helps to gain a relationships with your students, which can be done by acknowledging their emotions and desires, complementing achievements, and simply being present not just within the classroom but for doing extracurricular things. Throughout the video resource, we have explored behavior management. We have explored some of the theories behind why our students act the way they do, and we have provided behavior management skills to be utilized in the classroom. Thank you for watching.